Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County branch of the American Association of University Women, one of the civic partners for this show. Today I have Dr. Timothy Sellati of the Trudeau Institute in Saranac Lake with me in the studio. Dr. Sellati, welcome to North Country Matters. In fact, welcome to the North Country. You've only been here for about a year and a half. Dr. Sellati joined the Trudeau Institute in 2013 as an associate member. He's a past president of the Eastern New York branch of the American Society for Microbiologists. One of his areas of specialty is Lyme disease, which, as we know, has become a major health issue here in New York State in recent years. Today we're going to talk a little bit about public health, both from a historical perspective and about how it applies today in the face of current events, including the recent measles outbreak. Originally founded in 1884 as a tuberculosis treatment and research facility, the Trudeau Institute today is an independent, nonprofit biomedical research organization whose scientific mission is to make breakthrough discoveries leading to improved human health. Dr. Sellati, could you give us a thumbnail sketch of the history of tuberculosis in the late 19th through mid-20th centuries and how the study of that impacted the whole study of public health and what we think of as public health today?
Okay, so it was really Edward Livingstone Trudeau, the namesake of the Trudeau Institute, that was one of the earliest physician scientists in the United States. He was a physician that cared for individuals that were suffering from tuberculosis, which at the time was known as consumption. And he also was a patient. He contracted tuberculosis while caring for his brother, who subsequently died from the infection. And perhaps most importantly, he was also a scientist. He really followed in the footsteps of famous physician scientists like Louis Pasteur and the German physician scientist Robert Koch, and really studied how to culture the bacteria, Mycobacterium tuberculosis, that is the causative agent of tuberculosis.
And tell us a little bit about why Saranac Lake was chosen for his institute and why it was important in the treatment of tuberculosis.
So again, sort of following on a famous German physician, Bremer, Edward Livingstone Trudeau understood that one of the few ways of caring for patients with consumption was to get them out of the environment that they were in. By the late 1800s, anywhere from 70 to 90% of the urban population, both in Europe and the United States, were infected and suffering from tuberculosis. And obviously this predates the advent of antibiotics. So what the physicians in Germany and in Europe and then in the US recognized is what you needed to do is get people out of the congested city environments where they had close contact with other infected individuals, bring them up to the Adirondacks where they could rest and eat good, healthy food and essentially convalesce, expose themselves to the healthy, cold winter air. And that's really the genesis for the cure cottages and the genesis for the Adirondack chairs. So patients suffering from tuberculosis would bundle themselves up in blankets and lay out in these Adirondack chairs. And many individuals actually were able to overcome this infection, but it really wasn't until the advent of vaccines in the early 1900s, the 1905, 1906, the BCG vaccine, that we really had a way to protect people from becoming infected. And it wasn't until the mid-1940s, with the advent of antibiotics and the discovery of streptomycin, that we had a way of actually killing the bacteria. Unfortunately, the bacterium rather quickly developed resistance against streptomycin, And it really wasn't until 1951 or 52 that a new drug, isoniazid, was really developed, and that is very effective at killing the bacteria. But that's really the last fundamental transformative advance in the treatment of tuberculosis that we've had. And since then, we've sort of been losing the war against mycobacteria because they're developing antibiotic resistance now.
Right, right. Another disease that we want to take a look at from a historical point of view is polio. In 1952, the worst polio outbreak in American history infected 58,000 people, killing more than 3,000 and paralyzing 21,000. The majority of them were children. When the polio vaccine was developed by Dr. Jonas Salk, it became available in early 1954, and at that time the fear that parents had was that it wouldn't be available for their kids fast enough, because the country was really terrorized by that disease, and they were looking for help. Can you describe for us a little bit about what the introduction of that vaccine meant and how it impacted public health and the perception of public health? Because really that's what we've seen in the last few years, is that we don't believe in public health anymore, do we, kind of?
Yes, unfortunately we don't. And really the development of the Salk vaccine had a profound effect both on the provision of public health, to the general populace, and also the general public's thinking about the importance of having a robust public health infrastructure, having a means of providing vaccines to individuals. So, I mean, as you pointed out, prior to the development of the vaccine, anywhere from 15 to 20,000 individuals a year suffered from paralysis due to poliomyelitis, and roughly 2,000 plus would succumb to that disease. The year that they implemented the vaccine, those numbers dropped to about 1,000 cases a year, and then subsequent to that, it's only been 100 or so, or even fewer.
Right, and in fact, when Dr. Salk died in 1995, polio had virtually been wiped out. It was virtually extinct in the United States and really dwindling worldwide. I'm from the generation of kids who got everything, because I was before all of, not perhaps before the polio vaccine, but I was before, the mumps and rubella and all that kind of stuff. And I can remember as a young child, the winter of what my parents call their discontent, because they had 4 kids who were sick and we kept giving everything to each other, and they literally set up an infirmary, and we had the measles, we had the mumps, we had the other measles, we had the this, we had the that. It was just a hideous winter. And remembering that as a child, when it was my turn to be a parent, I was a big proponent of vaccinations because I didn't want to have to go through that providing the care for those kids.
Right.
So that kind of brings us, I think, to measles, which has been around for centuries. In fact, it's blamed in part for decimating the native population here in North America when the Europeans came over, because the natives had no natural immunity from any of these diseases that the Europeans were bringing over, because they'd never been seen on this continent before. Measles literally affected millions of people around the world. The first vaccine was licensed in 1963, and it was declared eradicated in 2000, but this year it was back, and it was back big time.
Right.
So one of the big challenges in the 21st century seems to be, how do we address this resistance to vaccination from people who don't know what it's like to have those kinds of sicknesses go through them, because they don't have it in their personal experience. How did vaccines get such a bad rap when they do so much good?
Right. So they essentially developed a bad rap back in the late 1990s. I think it was in 1998 that Andrew, I'm thinking of his name now. It's not Hatfield.
probably not McCoy either.
Wakefield, that's it. Very good. Andrew Wakefield published a study in a very well-respected British journal, Lancet, where he proposed this connection between vaccination of children with MMR, the measles, mumps, rubella vaccine, and the development of autism. And one component of the vaccines was implicated. It's called thimerosal. It's essentially a mercury-based preservative that was used to maintain the shelf life of the vaccines. And subsequent to that report, this really stirred a lot of concern, but also controversy in the scientific and the medical research fields. And by 2001, the manufacturers of the vaccines had already either completely eliminated thimerosal from the vaccines or significantly reduced the amount to just trace amounts in the vaccines. But between 2002 and about 2004, a number of studies, much larger patient cohort studies, were conducted, and they were unable to demonstrate that connection between vaccination and the development of autism. And yet, despite a vast number of studies to the contrary, this idea that there is or should be a concern about vaccinating your children and autism has really sort of grabbed hold in the minds of some individuals in the country.
Right, and there's nothing like the power of wrong information sometimes to take over the discussion.
Unfortunately, yes,
yeah.
Yes.
And of course, at the same time that was happening, we were also seeing a big rise in the incidences of autism, and that may have been a function of more and better diagnosis, but it seemed like those two things were reinforcing each other when in fact they were not in terms of the actual science.
Right.
Yeah.
But one of the fundamental tenets of scientific or medical research is the ability to reproduce results.
Right.
And if you cannot reproduce the results, that calls into question the validity of the original studies.
Which unfortunately still doesn't change what people have lodged in their brains.
No, no, it doesn't.
One of the things that I'd like to chat with you a little bit about is kind of the responsibility for public health. The idea, how's that changed over time? In other words, at one time, did people say, well, I have a part to play in this, or has public health become sort of an amorphous thing that the government will take care of that, or somebody else, the medical community will take care of that, or do people still have an individual responsibility towards the public health in the way we think of the common good?
Right. I think it's a combination of all of those things. On one end of the spectrum, we have the World Health Organization, which is responsible, plays a critical role for trying to ensure the integrity of the public health system across the world. And on the other end of the spectrum, you have individuals exerting their rights, perceived or otherwise, to decide whether or not they or their children are vaccinated or not. We've certainly, I think, moved away from the idea that public health responsibility rests principally with the federal government or with states. It does to some extent, but I think the pendulum has also swung in the direction of allowing a lot of individual freedoms to decide, do I want to be vaccinated or not? Do I want my children to be vaccinated or not? And that can have problems associated with it. The most significant problem is undermining the concept of herd immunity, which the country has really relied heavily upon, and we're not able to do that now.
Yeah, let's take just a second to define herd immunity for folks in case it's a phrase people might not be familiar with.
So the best way to understand herd immunity is to have a scenario where you have two individuals that are infected and they can communicate that infectious agent to other individuals. So person number one goes into a room with 100 individuals. 97 of them are vaccinated, only 3 of them are unvaccinated. Infected individual number 2 goes into a separate room, 100 individuals in that room. Only 70 of them are vaccinated, 30 of them are unvaccinated. So the likelihood of this individual number 2 coming in contact with an unvaccinated person and transmitting the pathogen to them is 10 times greater than in the other room. So not surprisingly, the larger the pool of unvaccinated individuals in the population, the more rapidly the disease is going to spread like wildfire. And so we've lost that collective protection against the rapid spread of infectious agents.
And in the case of something like measles, it's very easily transmitted. So
very much so.
So it's one of those things. In fact, measles epidemics actually often follow other kinds of humanitarian crises. So if you have a situation where, for example, there's a natural disaster or an earthquake or something like that, and you get that infectious agent, it can go very quickly and do a lot of damage if people don't have the vaccinations.
And cases of infection really tend to increase exponentially.
Right.
So back in 2013, there were perhaps 200 cases across the country of measles. In 2014, it was up to 600 cases. And so it'll be interesting to see, a little scary to see what it might be in 2015, 2016, 2017.
Well, one of the things that you mentioned was vaccinations, and in 48 out of 50 states, they allow for religious exemptions to vaccinations, which you really can't prove. Somebody just comes in and says, I'm opposed to it on religious grounds. 20 of those 48 states also allow a philosophical exemption for people who object to immunizations because of a personal, moral, or other belief. Only Mississippi and West Virginia don't allow either religious or philosophical exemptions. So the cumulative effect of exemptions really weakens herd immunity, and particularly in situations like where there's a lot of people who congregate, as we saw in the Disney World example of the measles back in January. So
a lot of people congregate in school settings as well, and what's particularly scary about this trend towards not having children vaccinated is that in some states, and these are statistics for I think 2013, 2014 from the CDC, in some states more than 4% of the kindergarten age population is unvaccinated. And little children are little walking incubators for all sorts of bacterial and viral pathogens.
And for the kindergartner who has maybe 1 or 2 younger brothers, sisters at home, including one who's an infant who's too young to get the measles vaccine, that is even a greater danger for them to bring that home to the younger kids in the family.
And then on the other end of the age spectrum, many of those very young children come in contact with grandparents or other elderly individuals that are immunocompromised because of age or other medical conditions, and then, you know, what is an infectious disease that someone in the 15 to 50 age group can handle. Individuals that are much older, these types of infections can be very serious, even life-threatening.
Yeah, I was actually interested to read that it is the over 60 population that is particularly at risk because they may have missed these as a child. They may have missed getting sick, and all of a sudden here is that second go around, and you're not a kid anymore by any means. So do you think that the existing rules about exemption should be rethought and tightened up in terms of, particularly now that we've had this long period of time where people don't have any direct personal experience of these kinds of diseases?
I think so, but it's a very, very difficult, it would be very challenging to try and do that, because I think the general public seems to be migrating towards this idea that you know, I'm going to do what I want to do and you can't tell me what to do. And so there's this notion of personal freedoms, either at the individual level or at the local or the state level versus what the federal government or the public health infrastructure dictates should occur, that is really coming into play, and it's making it difficult.
And of course, that's also complicated by the people who don't trust government and the science deniers. And,
Absolutely.
You know, we're actually, I read in one place that it was described as a new age of ignorance, which is being raised up on high and worshipped. There's people who categorically deny science. So what is that? What are the implications for that, for our ability to meet the kinds of public health crises that we've seen in the past, and that, you know, we know, particularly now in the age of much more travel and much easier ways to communicate these things. I can remember the SARS outbreak and how quickly that spread from a very isolated set of origins, and all of a sudden that went everywhere, and it went there pretty quickly.
Right, right. I think until the consequences of diminished herd immunity start impacting the general public in a very personal way, I think it's going to be difficult to counter this anti-science mentality.
So, as is always the case, we have to learn the hard way.
Yes.
You know, and this speaks to your work personally when on things like Lyme disease. But one of the things that we see is that as the climate changes, that we're seeing new diseases pop up in places where they've never ever been before. And that there's an ecological basis for a lot of disease transmission now, simply through things like ticks, mosquitoes, and all the rest of it. We're seeing subtropical and tropical diseases go into temperate areas, and you know, I know we've had a couple of bad winters here, but it hasn't knocked the tick population down very much, has it?
Oh no, absolutely not.
So. What do you think in terms of things like climate change are going to play? How's that going to play out in coming years? And what do public health organizations need to do to think about responding to these issues, you know, so that they're not caught flat-footed?
Right. I think the most important role for public health organizations is to try and educate the general public and perhaps more importantly the physician population in a particular area. So for example, the North Country. There are certain areas of the North Country where if you went to your physician with a classic bullseye rash associated with infection with the bacterium that causes Lyme disease, they might not think about Lyme disease as a potential cause for that bullseye rash because their mentality is, well, that couldn't possibly be Lyme disease because we're in the North Country and there are no ticks in the North Country. But we know through our field studies this past summer in collaboration with the New York State Department of Health and Paul Smith's College and now Clarkson University, that there are most definitely ticks in the North Country, and they do carry Borrelia burgdorferi. And so we have to re-educate or refine the education of physicians to be more attentive to the possibility that they could have a patient that's presenting with a tick-borne disease, either the bacterium that causes Lyme disease or tick-borne viruses like deer tick virus or Powassan virus. I
certainly know people who were exposed to Lyme disease years ago and it wasn't properly diagnosed, and the downstream physical consequences of that are very, very serious.
Yes, yes, they are.
So, you know, missing that diagnosis has a big impact on someone's quality of life, that's for sure.
And I think we have to figure out what to focus on and what not to focus on. The whole concept of climate change has sort of gotten polarized. And, you know, instead of focusing on what is causing climate change, let's simply acknowledge that climate change is occurring. It doesn't matter what side of the political aisle you sit on. The ticks know that the climate is changing, and they will bite a Republican just as readily as they will a Democrat, and perhaps infect them with a bacterium or a virus. And so we need to understand what are the factors that are allowing ticks to migrate further north into the North Country and further west into western New York, and how can we protect individuals against.
Yeah, and that's the same way that the insurance companies are acknowledging that the results of these increased storms are affecting their bottom line, and we're seeing rates go up because,
right.
As you say, regardless of what caused it, it's happening. So
right.
One of the things I'd like to ask you about is, we've talked about the immunizations for kids before they go to school and that sort of thing, but there's also adult populations that aren't keeping up with their routine immunizations either, in terms of whether it's something tetanus, or shingles. I just listened today to a radio program, and a woman said that she and her husband did not have her kids vaccinated, but her husband got shingles and promptly infected the two kids with serious forms of the measles. She said, there I was with a sick husband who couldn't do anything, and two little kids who had the measles, and I'm a believer in vaccinations now, right, because she learned the hard way. But adults sometimes don't think about the fact that maybe they were immunized as kids, but those immunizations have maybe broken down over time, and you need boosters.
Right. No, that's definitely another sort of controversial aspect of the whole vaccination field is this idea that you're vaccinating little children and you're vaccinating the elderly, and what potentially falls through the cracks are those individuals, the 15 to 45 or 15 to 50-year-olds. And with influenza and other, it is truly not as important to vaccinate the elderly. Not that the elderly or other groups don't want to hear that, but it's more important that you vaccinate that group in the middle, because the group in the middle are the ones that are more active, more likely to come in contact with other individuals that are infected. They are often the caregivers for their children, but also potentially the caregivers for their elderly parents.
Right.
And so, there's a greater likelihood of the elderly becoming infected from contact with someone in that 15 to 50-year-old range, or a child that hasn't been vaccinated.
Mm-hmm. Mm-hmm. So there's a lot to this this big picture. I know in the last year I've been vaccinated for hepatitis, shingles, tetanus, diphtheria, pertussis, and the flu. And I'm a big fan of the Affordable Care Act, because it meant all of those vaccinations were free to me through my insurance company. And so there's really no reason not to get vaccinated, in terms of it's not prohibitive cost-wise anymore, where
Correct.
A few years ago that might have been the case. And as I said earlier, if you've ever lived through a bunch of little kids being sick in the same house, you would think twice before you did that. You did that purposefully, I think. So,
right.
So tell us what message you'd like to leave our audience with in terms of public health and these kinds of things, and that vaccinations really are much better for you than the minuscule chance that they're not.
Right. So for me, I think the take-home message would be, let's not focus so much on vaccines and vaccination. And I know that's sort of a controversial. I think what we really need to focus on is the development of next-generation antibiotics. Because vaccines are fine for protecting individuals against infection, but there are a lot of very insidious antibiotic-resistant bacteria out there in the environment. And they are responsible for an inordinate number of deaths annually. And there is no really strong concerted effort to generate new antibiotics to combat this antibiotic resistance wave of pathogens that we're dealing with. So I think the same way we have a World Health Organization, maybe we need a World Therapeutics Organization. The industry, the biotech industry, the pharmaceutical industry, just does not see the monetary value in taking these new classes of antibiotics from inception to the pharmacist's shelf. So someone else, some other entity has to step in and pick up the slack there.
Well,
and make them available to, individuals in the U.S. and really across the world.
because once a causative agent like that gets a hold in a population, it doesn't quit, does it?
Right, that's true.
So,
But once you eradicate an infectious agent from the human population, you don't need to vaccinate anymore.
right. But that's a hard job.
Oh, that's a very
job.
hard. That's a very hard job. Yes.
Well, thank you
yes.
very much for coming in today. It's been a fascinating discussion, and looking at it both from the historical point of view and the current point of view, and now we can worry about what's going to happen tomorrow. So thanks for that. So our time is up. Thank you. These conversations are a production of North Country Matters, produced here in the studios of WCKN on the campus of Clarkson University. This show is a civic collaboration between the St. Lawrence County branch of the American Association of University Women, the St. Lawrence County League of Women Voters, and the Communication and Media Department here at Clarkson. Until next time, remember, our North Country matters.